If you're a frequent runner, or even if you've just been starting out, then you'll probably experience a few different aches and pains while you've been out pounding the pavement or even on running tracks. This series of short videos will explore 5 common running injuries that we see in our physiotherapy clinic, Leading Edge Physical Therapy, and outline some really useful ideas to help alleviate these issues. Hi, I'm Andrew Darcy. I'm a sports physiotherapist from Adelaide in South Australia, and the next on our list of common running injuries is iliotibial or ITB Friction Syndrome. ITB Friction Syndrome is a common condition that affects the outside of the knee and often causes pain, swelling, burning, a sort of feeling of friction or even compression when running. It's felt on the outside of the knee. It occurs when the iliotibial band, or the ITB, which runs along the outside of the thigh from the hip to the knee, rubs over the knee and becomes irritated. Poor biomechanics of the hip, knee and foot are commonly at fault, which increase the tension on the ITB and cause a certain amount of friction between it and the structures underneath. So how is ITB friction syndrome treated? Well, the 3 key areas to address immediately are pain management, reduction of inflammation, and load reduction. These can be achieved by icing the affected area, anti-inflammatory medications, reducing the amount of running, and your physiotherapist can use these range of treatments, including massage, dry needling, foam rolling, stretching, and exercises that strengthen to correct your biomechanics. By releasing and stretching the gluteal, hip flexor and thigh muscles with prolonged stretching and foam rolling, the tension on the ITB can reduce and allow you to run with a lot more freedom and less pain. ITB friction syndrome is also a common condition that is affected by poor biomechanics. At Leading Edge Physical Therapy, we work closely with the team at the Biomechanics Lab, which is Australia's only private 3D biomechanical analysis system. This is the best way to identify if you have any underlying biomechanical faults with your running technique that might be causing you pain. So if you have pain on the side of your knee, I'd highly recommend that you make an appointment to see Chris and the team at the Biomechanics Lab, and they'll get you moving in the right direction towards being pain-free running. Stay tuned for the other common running injuries in this series of videos to see how you can improve your running and get back to running pain-free.